Understanding asthma is crucial. This chronic respiratory condition affects millions of people around the globe, impacting their daily lives and overall well-being. Asthma is a chronic respiratory condition that affects millions of people worldwide. It does not discriminate, affecting individuals of all ages, races, and backgrounds. It is characterized by inflammation and narrowing of the airways, making it difficult to breathe. During an asthma attack, the muscles around the airways tighten, and the lining of the airways becomes swollen and inflamed. This can lead to a variety of symptoms, including wheezing, coughing, shortness of breath, and chest tightness. These symptoms can vary in intensity and frequency, sometimes becoming severe enough to require emergency medical attention. Asthma can range in severity from mild and occasional to severe and life-threatening. Some people may experience symptoms only during certain activities or exposures, while others may have persistent symptoms that interfere with daily life. Asthma is a serious condition, but with proper management, most people can live normal, active lives. Effective management includes avoiding triggers, taking prescribed medications, and monitoring symptoms regularly. It is important to understand the different aspects of asthma, including its causes, symptoms, diagnosis, and treatment options. Education and awareness are key to managing this condition effectively. By working closely with a healthcare professional, individuals with asthma can develop a personalized plan to control their symptoms and minimize the impact of the condition on their daily lives. This collaborative approach ensures that each person receives the care and support they need to manage their asthma effectively. Asthma is classified into different levels of severity based on the frequency and intensity of symptoms. This classification helps healthcare providers determine the most appropriate treatment plan for each individual. Intermittent asthma is the least severe form, characterized by infrequent symptoms. Persistent asthma, on the other hand, involves more frequent and persistent symptoms. Persistent asthma is further categorized into mild, moderate, and severe, depending on the impact of symptoms on daily life and lung function. The goal of asthma management is to achieve and maintain control of the condition, reducing the frequency and severity of symptoms and improving quality of life. Recognizing the symptoms of asthma is crucial for early diagnosis and effective management. Common symptoms include wheezing, a whistling sound produced during breathing, especially exhalation. Coughing, particularly at night or early morning, is another common symptom. Shortness of breath, a feeling of not being able to get enough air, can occur during an asthma attack, or even at rest in severe cases. Chest tightness, a feeling of pressure or constriction in the chest, is another symptom that may accompany an asthma attack. It's important to note that asthma symptoms can vary from person to person and may change over time. If you experience any of these symptoms, it's essential to seek medical attention for proper diagnosis and treatment. Diagnosing asthma typically involves a combination of medical history review, physical examination, and specific tests. A healthcare provider will ask about your symptoms, their frequency, and any triggers that worsen them. They will also inquire about any family history of asthma or allergies. During the physical exam, the doctor will listen to your lungs for any wheezing or other abnormal sounds. Pulmonary function tests such as spirometry measure how well your lungs are working. Spirometry involves taking a deep breath and exhaling forcefully into a mouthpiece connected to a machine. This test helps assess lung capacity and airflow, key indicators of asthma. Another test, called a methacillin challenge, may be used if spirometry results are inconclusive. This test involves inhaling increasing amounts of methacillin, a substance that can trigger asthma symptoms. If your lung function decreases after inhaling methacillin, it suggests that you have asthma. In addition to these tests, doctors may also use peak flow monitoring. This involves blowing into a handheld device that measures how quickly you can expel air from your lungs. Regular monitoring can help track your asthma over time and determine if your treatment plan is effective. Allergy testing might also be recommended to identify specific allergens that could be triggering your asthma. Skin prick tests or blood tests can help pinpoint these allergens, allowing for more targeted management of your condition. Overall, a comprehensive approach combining medical history, physical exams, and various tests ensures an accurate diagnosis and effective management of asthma. This thorough evaluation helps tailor a treatment plan that best suits your individual needs. Remember, early and accurate diagnosis is crucial for managing asthma effectively and improving your quality of life. Always consult with your healthcare provider for the best course of action. With the right tests and procedures, you can take control of your asthma and lead a healthier, more active life. Section 5. The science behind asthma, receptors and their roles. To understand asthma, it's helpful to understand the role of receptors in the airways. Two key types of receptors involved are muscarinic and beta-2 receptors. Muscarinic receptors, when activated, cause the airways to constrict, making it harder to breathe. Substances like dust mites, pollen, and pet dander can trigger this response in people with asthma. On the other hand, beta-2 receptors, when activated, cause the airways to relax and open up, making breathing easier. Medications called beta-2 agonists, like albuterol, work by stimulating these receptors. Understanding the interplay between these receptors helps explain why certain triggers worsen asthma symptoms and how medications can provide relief. Section 6. Inside an asthma attack. Understanding the pathophysiology. During an asthma attack, the airways become inflamed and constricted, leading to the characteristic symptoms. This complex process, known as pathophysiology, involves various changes within the airways. The inner lining of the airways becomes swollen and inflamed, narrowing the air passages. Muscles surrounding the airways contract, further constricting the air passages. The cells lining the airways produce excess mucus, which can clog the airways and make breathing even more difficult. This combination of factors significantly reduces airflow, making it difficult to breathe in and out effectively. Section 7. Managing asthma, quick relief, and long-term control. Managing asthma effectively involves two main approaches: quick relief medications for immediate symptom control and long-term control medications to prevent future attacks. Quick relief medications, often called rescue inhalers, are designed to provide rapid relief from sudden asthma symptoms. These inhalers typically contain short-acting beta-2 agonists, like albuterol, which quickly relax the airway muscles, improving airflow and reducing symptoms. Long-term control medications, on the other hand, are taken regularly to prevent asthma symptoms from developing in the first place. These medications work by reducing airway inflammation and hypersensitivity, making the airways less likely to react to triggers. Section 8. Tailoring treatment steps for different asthma severities. Treatment for asthma is tailored to the individual's specific needs and the severity of their condition. A stepwise approach is often used, starting with minimal medication and gradually increasing the dosage or adding medications as needed. For mild intermittent asthma, a short-acting beta-2 agonist used as needed may be sufficient to control symptoms. As asthma severity increases, long-term control medications, such as inhaled corticosteroids, may be added to the treatment plan. In more severe cases, higher doses of inhaled corticosteroids, long-acting beta-2 agonists, or other medications, such as leukotriene modifiers, may be necessary to achieve and maintain asthma control. Section 9. Living with asthma, practical advice for patients. Living with asthma requires proactive management and lifestyle adjustments. It's not just about taking medication when you feel symptoms. It's about creating a daily routine that minimizes the risk of asthma attacks and keeps your condition under control. Work closely with your healthcare provider to develop a personalized asthma action plan, outlining steps to take based on your symptom severity and peak flow meter readings. This plan should include daily management strategies, emergency steps, and regular checkups to monitor your condition. Identify and avoid your asthma triggers, such as dust mites, which can be found in bedding, carpets, and upholstered furniture. Use protective covers and wash bedding regularly to reduce exposure. Other common triggers include pollen, pet dander, mold, and smoke. During high pollen seasons, keep windows closed and use air conditioning if possible. Regularly clean areas prone to mold and avoid exposure to cigarette smoke. Take your medications as prescribed by your doctor. even when you're feeling well. Consistency is key to preventing flare-ups and maintaining long-term control over your asthma. Regularly clean and replace your inhaler devices as instructed to ensure proper medication delivery. A clean inhaler works more effectively and helps you get the correct dosage. Maintain a healthy lifestyle by eating a balanced diet, exercising regularly, and getting enough sleep. These habits not only improve your overall health, but also help in managing asthma symptoms more effectively. Incorporate breathing exercises, jogging, or yoga into your routine. These practices can help strengthen your respiratory system and improve your overall health, making you less susceptible to asthma symptoms. Remember, with proper management and a proactive approach, you can live a full and active life despite having asthma. Stay informed, stay prepared, and stay positive.